Afternoon, everyone. I welcome you all to today's webinar on continuous patient monitoring and operational analytics in the healthcare industry. My name is Mohammed Abdullah, and I'll be your host today. Before we deep dive into the details, I'd quickly introduce myself, and then my colleagues can follow with their introductions. My quick introduction is that I'm working as a solution specialist at Veraqor. I empower customers when it comes to decision on right solutions for their technology capabilities. I'm more focused towards digital transformation and evaluate offers to different organizations. I'm joined by my colleagues. I'll start off with Safdar. Safdar, if you just can quickly introduce yourself.
Thank you, Abdullah. Hello, everyone. I'm Syed Safdar Hussain, Principal Cloud Solution Architect at Veraqor. And today I am excited to share with you how we are revolutionizing healthcare. We will explore how Microsoft Cloud for Healthcare empower health team collaboration and enable continuous patient monitoring. Thank you. Over to you, Fahad.
Thank you. This is Syed Fahad Ali Hashmi. Assalamu alaikum and hello to everyone. I'm technology solutions professional, taking care of data and analytics at Veracor, and we are closely working with our partner QDS as well in that regard. And today we're going to be talking about operational analytics and continuous patient monitoring. From QDS, Moussa Khaled is joining us, and he'll be introducing himself next.
Thank you, Fahad. Hello, everyone. My name is Moussa Khaled. I'm a business development manager here at QDS, part of the cloud division. And I lead a diverse set of clients to digitally transform their business, of course, with the power of Microsoft Cloud. And thank you for joining us today. And over to you, Abdullah, to go ahead.
Thank you, Musa. Appreciate it. I'm just getting goosebumps. So excited about this. Khadia, thank you so much. Appreciate it. So, guys, since me and Musa, we're mostly on the front end. My colleagues are there on the front end as well with the customers interaction. But we often, when we're interacting with customers, we do come across certain challenges that they face on a daily basis, and they're looking for solutions for better decision making. They mostly want to have control over their health data and provide insights for effective decision making. They also want to help their care teams connect with patients so that they can improve personal productivity and work together in impacting the overall efficiency of their operations, and also to harness data to streamline operations. Lastly, the most important one, they want to extend the healthcare beyond the healthcare facility. They want to use AI, data insights to provide more personalized treatments. Fahad, if you can go to the next one. I'll let Musa chip in with this fact about about the healthcare industry.
So, of course, we all know how COVID-19 affected each and every one of us, not only in our personal life, but also, of course, in our professional life. Now, according to Sid Nag, who's actually the Vice President of Research at Gartner, the pandemic actually forced organizations to preserve cash as well as optimize their costs when it comes to IT. And this is mainly to ensure resiliency. And this is actually the reason that the cloud became a convenient means to address all of these issues. As a result, the statistic that I actually want to talk about today is the fact that 80% of healthcare providers plan on increasing their investment in digital solutions. This is, of course, expected in the next 5 years, and hopefully this will allow all these healthcare professionals to stay ahead of the curve. Now, I just want to once again hand it over back to Fahad, who's going to be discussing a little bit more detail of how we can use the Microsoft Cloud in healthcare.
So the meat of our discussion today, what we're excited about is Microsoft Cloud for healthcare. Because obviously we want to choose the best platform out there for everyone to get to your goals as fast as you can. And the goals for today is to get the data and AI capability with the best security and compliance, specifically for the healthcare segment. And we'll be talking about improving clinical and operational insights, which basically rely upon accessing and securely sharing the actionable data insights for the clinical data that we gather. Along with that, the operational analytics. It's pretty simple, like operational analytics could be done in any industry. And, like you just have to get into the nitty gritty of the operations and try to see exactly where you want to go. And so that everything is clear and cut in front of you, so you could be taking better decisions. And it's at the end of the day for healthcare, it's super important that all the facts and all the information is right there tip top, with the data being to be the best quality that it could be. So you could gain the insights to help the end user, which is the patient, and also the management that is taking care, that's getting taken care around it. Along with that, definitely there's empowering the health team collaboration, which falls under the continuous patient monitoring and enhancing the patient engagement as well, which Mr. Safdar would shed some light on.
Yeah, thank you. I mean, Microsoft Cloud for Healthcare harness the power of the Microsoft Cloud by bringing together capabilities from Microsoft Azure, Dynamics 365, Microsoft Power Platform, and Microsoft 365 to transform the healthcare journey through more secure and connected patient experience. And you can create and personalize care plan and manage care team members and schedule and coordinate home visits. And you can customize Microsoft collaboration tools based on the need of your medical staff. So that's amazing, right? Yeah.
Right. Now, again, for today, the priority use cases that we have brought up, there could be a lot of things that we could be talking about when we talk about healthcare specifically. But for today, we will be talking about improving the clinical and operational insights and empowering health team collaboration. So let's get right ahead into the clinical and operational insights and what it has to offer. So specifically connecting data from across the systems and creating insights to enable the healthcare providers to predict risk. It's all about getting all the data from the disparate sources into a single place. So you would know that all your senses are in a singular place trying to get you to a singular goal. Just like walking a pathway with all of your senses, specifically hearing, smelling, or seeing and touching, and trying to figure out where you want to go. And as sharp as you are with that, you would definitely be able to take the assurance, care, and operational efficiencies to the next level. And that's what we aim to do it over here as well. Now, let's put it all in black and white. We see that the operational analytics focuses basically on enhancing the process efficiency. I'm just trying to give you an overview what operational analytics means, so you would know that what exactly the path would look like. The health industry is experiencing explosive data based on the increasing use of electronic health records. And we have seen that Moore's law actually applies not just to the development of the technology, but also to the enhancement and the collection of the data. And we've seen that today the health data is doubling every 4 months. And during the COVID-19 pandemic, we remember that we actually got a lot of data because the visits from the patients increased exponentially, and the operational data to train the predictive models became really nice. So definitely COVID-19 was a part where everyone was affected by it, but something came out of it, which we became to use in the right terms as well. And the intelligent operations analytics help to use the resources in the right way to optimize the use of expensive data sources. Now, the reason why it matters is the resource deployment, like deploy the resource into the COVID ways in a particular equity and leveraging various parts of it. Clinical empowerment, which is enabled sharing and analysis of data for all the stakeholders across the board. So, nobody would actually come in trying to say that, why are my numbers not matching yours? Or why is something that is not supposed to be in the report is mentioned in elsewhere in another department in a certain way. And improving the operational classes as well, where it reduces the cost and the time it takes to effectively get to the solution as well. Now, getting to the other side where we want to see how the pyramid looks like, what is the business value that we get out of it, specifically the departmental value that we gain out of it for the clinical analysis and the operational analytics. Now, when we talk about clinical analysis, we're talking about population health management, clinical research, behavioral analytics and alerts, imaging intelligence, and predictive care guidance. Most of the things with the boom of the AI are moving towards the predictive care guidance and the clinical research, because we have got the models to equip the clinical staff with the analytics that would make them to go to the next space. Also, the patients, they can be categorized in a certain format. That actually gives you the behavioral analytics and alerts, so you would be better equipped to get to the solution before the problem actually comes right into your face and it becomes an emergency. And about the operational analytics, it could be any of the department that you could be working with. It could be billing, it could be facility and supply chain management, it could be resource management. So for example, you have beddings all around in the hospital, and there's might be a surge during a certain season, for example, if the cold is starting, a lot of flu, patients might be coming in, and you want to prepare for that in advance. Now, that is something that comes under resource management. You need to buy a lot of appliances, a lot of staff has to be overboarded, and you have to take care of all the things that are already in your inventory. That can be forecasted instead of people like account managers sitting separately in board meetings trying to figure out how you would be managing the next month. That could be taken care of by a single couple of models just trying to give you the forecast for the resources and automated alerts, in which we include the facilities and equipment management as well, and predictive maintenance as well, because there is a lot of points in the data or the journey that we just saw, Mr. Abdullah just showed us in the initial slides. There are a lot of points where we want to see things into details. As we see that the data governance on the mid of the pyramid or the base of the pyramid is giving us the operational data with Azure Synapse, but we have definitely moved with Fabric right now. We put Synapse so that people would get the hook of it as to where we want to move next. And that definitely is Fabric. Now, as we talk about Microsoft Fabric, what we aim to do, I mean, definitely we want to know where do we start with this whole journey so that we get to the point we want to. But the point that we want to start is that we have to unify the disparate sources, data sources, to establish a singular in-depth profile for each patient. Now we can see on our screens that the data points that the information is coming from is usually from the engagements, emails, segmentations, EHR. I mean, we usually take the data for the EHR and any kind of data like phone numbers or the number per person's vitals or names. And that's the only data that people are trying to get to. But there's a lot of other data that can be actually get to through APIs or through the information that we directly get from the patients. Like, for example, the laboratory test dates, data, or the patient trends, because we have a lot of data for all of the patients covering up. We could be matching them up. And definitely reach to an interoperability, which has enriching and unifying data capabilities to get you to the faster innovation that we're aiming to. Now that we have established that the point to start is getting all the data into a singular place, we see where we want to move next. Now, this right over here gives the pathway for enabling organizations with proven technology. There's IoT, and then there's analytics that are trying to work together. We start with your existing systems. Usually when we go out with the clients for healthcare, the basic, most important question, I believe Mr. Abdullah and Mr. Moussa would agree with me on this, that the clients, the basic problem that they are coming through, or the challenge that they're coming through, is that they've already invested in some other existing system. It could be Cerner, it could be Epic, it could be all scripts. And they're trying to know like how exactly would we move from here, because we have already built our data estate on top of it, and a lot of systems and a lot of APIs are connected to it. Wouldn't it be a lot of work to get out of it and restructure everything? And we have a very simple answer for that. That's not a problem when it comes to Microsoft, because we start I mean, the methodology behind the whole building of this infrastructure is that we want to inculcate or incorporate everything that comes along our way. It could be Epic, Cerner, all scripts, whatever it is. We try to bring it all into the raw layer, all the data that is there, and we build everything into the medallion architecture, which we will see in a bit as to how that goes. There are certain connectors for each of the capability that you want. It could be governance, health data models, interoperability, or intelligence platforms. Like we all know about the Copilot that has come in as well. That could be trained on top of your data. There's governance in form of Azure Purview, and we have models for our health compliance as well. So we don't have to go thinking about exactly what we need to put in a certain space. It's all right there. In many of the times, it's just configuring it the right way so that we could get the data out of it. Then on top of it, there's, yeah.
Sorry. Yeah.
Yeah,
So
Mr. Safdar would like
top
to
of it, yeah, and top of it, I mean, the Microsoft Care collaboration portal help your frontline healthcare worker share knowledge and collaborate more efficiently to optimize care team performance and strengthen care pathway, right? So that would really help, right? And the care team
It does.
specifically. Yeah.
Yeah, it definitely does, because see, the point is to hit all the targets at once and connect everything in a singular place. Like we see that the application layer actually includes the Power Platform, includes the Microsoft 365, includes the Dynamic 365.
Yeah.
Like think about it like this, like for example, how many times do we actually communicate on Teams? Like almost all day, right? And that's the same thing that is going on in the IT staff or the operational staff in healthcare as well. Now, right while we are talking in the Teams, imagine, like, I don't have to exit the team to look at a certain patient that I'm talking about. It could be popping up right up into the Teams screen. Now, that is the kind of innovation or the kind of incorporation that we're looking forward to. And think about all the healthcare capabilities that we'll be enabling through that. I mean, you will definitely be covering about the care collaboration down the road as well. And we'll see how that collaboration actually works. And getting the insights is something, and getting insights everywhere is something else. So what we are aiming for is to get the insights everywhere. I believe Moussa was raising his hand. Is he had a question or something?
Yes, Fahad, actually. One thing that I wanted to ask, since you did mention IoT and data analytics, could you just outline some of the challenges that you might face when integrating with these existing systems that you mentioned? So you have these existing systems like Epic, like Kerner, etc. So what type of
Yeah.
challenges would you expect when going through with these integrations?
Well, when we talk about, there are two parts to the question, right? Like, first and foremost, like how IoT and analytics are actually working together to optimize the treatment. And then the second one, I believe you said that what are the challenges into getting to that spot, right? So IoT and analytics work together to optimize treatments by collecting real-time patient data through all the connected devices and analyzing it to provide personalized and timely care. Now, the way is that we do not have to think about it in a different way. All of the data, because we'll be using Fabric, is dropping into a singular space. We have to just do the fragmentation on top of it, extracting the features, and then combine it together so that we could get to the final stage, which is providing the personalized and timely care. That's all about that. Now, the challenge in integrating these technologies into existing healthcare systems includes data security, right? Because this is PII, and this is the highest form of PII that could be there. There's a lot of ministerial data as well. People don't want their reports to getting out. So data security is very important. Interoperability between different devices and system is important, which Fabric is giving in meticulously, because we have recently established a certain project for one of the leading healthcare in Qatar, which has Cerner implemented in their operations and environment, and we took the Cerner to the Fabric. And the last one is definitely ensuring data accuracy and reliability. But see, the good thing about Microsoft is that we are able to tackle all of those data into a singular platform, a software as a service that has been given to us. So hope that answers the question.
Perfect. Thank you, Fahad.
Right. All right, so let's quickly see the solution overview as well. Now, what we see on our screen is like the next generation of the healthcare solution that has been provided by Fabric. Fabric in itself is something that Microsoft has developed on top of Azure Synapse. Like, it's the next step of the analytics. Everything in a singular place. You don't have to configure or go out there and get the separate components put into a singular place. It's a software as a service. Everything is right in one place. Like, if you have Power BI, you have Fabric. And the thing that it actually provides is it provides you data analytics capabilities along with all the teams working into a singular space. So once we put that in, we could start with all your data sources, put it for a while now, but now we have a fancy way to call it so that we can put it into the right terms as well, which is starting with the raw layer and moving all the way to the bronze, and then all the way to the gold layer, where the golden context of the data exists. The one thing that I want to highlight is the text analytics for health, specifically for health. We have, like for rest of everybody's using the ChatGPT 4.0, which has given the capability even to the normal people to, citizens and developers to put in the information about like a PDF form or an image, and it would be able to take out the language on top of it. But text analytics for health is something way beyond and above that. It is trained on medical language. So anytime you put any document into it, it could be a paper, it could be some receipts coming in, or it could be some reports coming out of the patients right straight up from the machine that you've taken. in it and would be able to recognize what kind of information is in there. It could be different names. It could have different, diseases that or diagnostics or the medical information that has been given there could be put out in a separate space, and the analytics could be provided on top of that. Now, three big advantages to go with this right now is to reduce the average length of stay. Now, these are real benefits that are going to be there. Integration and visual automation of patient medical records results in a reduction of average length of stay by 3%, which is good because if you start to sum it up, it becomes a pretty big number. Second one is to decrease the cost by reducing duplication. Now, record duplication results in more than 20 billion US dollars in health costs annually. Now, these are the numbers that are coming from the Gartner and the Microsoft combined research. And through AI and smart data management solutions, decrease duplicate work by 5%, which is a huge number, again, if we accumulate it at the end of the year. The third one is to increase the revenue opportunities, and that is by replacing the data silos with the centralized analytics-driven platform, and the customers can increase revenue by 10%. And the way to actually increase the revenue by 10% is to take the right decision in the right way. So we could be benefiting from the promptness of it. You know, there is no lag in the warehouse. There is no lag in the supply chain. There is no lag in the billing. There is no duplication in the records. Everything is super straight up clean. So the decision-making just becomes faster, right? Now, moving on, I was talking about the text analytics. There's a quick one that I wanted to show you right over here. This is an excerpt specifically from an evaluation against the SARS-CoV-2 infection. And you can see that it's picking up the tags right there. It's telling that what the diagnosis is, what the medication name was given, what medication class it falls in, what's the treatment name, or what's the body structure like, in examination value and examination unit as well. Now, this might not look like a lot to naked eye, but once we put it into our models, it would be able to pick up all the tags and it would be able to give you the insights that you require for. So a few use cases that I mentioned on the left side are to extract the insights and its statistics. Obviously, those are very important, and those are coming out straight up from the papers as well. There's developing predictive models using historic data, annotating and curating the medical information. So this could be taken care of by the actual humans reading it up and trying to like make the changes to it. Then reviewing and reporting medical information as well. Yeah,
it's really important. I mean, specifically extract and labels the relevant medical information from unstructured text, such as doctors' notes, discharge summaries, and clinical documents, and EHR, etc. So by using this, text analytics for healthcare, a feature of you can leverage the cognitive services, you can convert, unstructured health data into structured health data, and to enable further processing, right? And this service, can write the structured data in the format of JSON file, or you can leverage the FHIR bundle of interconnected hierarchies of the resources. That's really helpful for the predictive in the healthcare industry. Yeah,
that's super important. That's very true. Now, moving on to a quick solution demonstration as to like when we get everything in place, how it would look like. Just bear a minute with me so that I can share exactly what we can assume that it would be looking like. Let me know if the screen is visible to you guys. We see that at the end of the day, when we have put in the numbers and we have put in the data into a singular place, you guys can expect to see something like an executive dashboard, what we see on the screen right now. We have healthcare financial analytics, we have real-time operational analytics and real-time quality of care analytics, and predictive and prescriptive analytics as well. Now, this over here is for the people who are sitting at the epitome of decision-making and they want to know what the picture looks like. The big picture looks like what kind of bed occupancy rate and average length of stay do we have? What are the patient experiences by department right over here? And what are the negative ones? And what are the positive ones, what are the neutral ones, and also know what the revenue or cost migration could be moving towards. Now, with this information given on your fingertips, there is a lot of way you could be churning it. Given the new Copilot that has come in, there is something for everyone over there. Now, moving on to the next one, there is operational hospital management as well, where you see the hospital overview. So this is something which is the connected coordination comes in. We see that there is a lot of movement happening on the floor of the hospital, and we should be able to know where the heat maps are going to. This makes things very easy, specifically for the readmission rate or the bed occupancy rate or the doctor or nurses into a singular place. This could be a very good space for the resource management. And when we come to the resource management, the only thing that we are very careful about is it's not just the human resource management, it's also about things that are being used, the specific material that is being used. So average ER wait time could be brought down. Moving along, let me know if the screen is pretty visible to you guys. Here we see the bed demand and the available census reports. You could, if I hover over these, it would tell me what stuff that is supposed to be into a singular bedroom for a patient is in stock, or we have ran out of it, or if it's like running low. So you could be ordering it pretty in advance, so to the patients at the end of they won't be effective. We have the bed demand versus available census as well, and we could be going in different spaces. Like for example, if you have like healthcare branches across the world or across a certain location, this could be something taken care of that in the same bed as well. Now mind us that this is all of the stuff that is happening into a singular place, and it's all custom made for you. So you could be creating any kind of stuff around that. This is not something that is a solution or like a product out of the box. It is something that can be curated specifically to how you want it to be done. We have patient search coming in. We have all the specific consultation and treatments coming in. And as I mentioned, that we have a sentiment analysis happening on each kind of note that we are putting in. It could be negative, or it could be positive, whatever there is. And then there is a detected language as well. So if you have some healthcare in a foreign language, it would be able to pick it up and give you the specifications about that as well. We move toward the patient overview. Now, I mentioned to you a certain place that bringing in all the information into single place would give us a 360 view of the patient. We're talking about not just the lab results or the hardware this time. We're also talking about the patient overview and history. Right over here, I've put the team's screenshot in there, so we can see that how Retta Taylor's information summary education care team can be specific, can just be embedded into the team's part. And while you're talking to the backhand staff, you should be able to collaborate right there and then. You don't have to exit the screen or the Microsoft Place. Over here, yeah, is there a question? No? All right. Over here, we see the Azure Cognitive Services where, again, the good part about is that using the APIs and the connector, we should be able to bring in all the medical journaling or the papers into a singular place. And I cannot mention it enough that not leaving the place that you're working in, not leaving the environment to go to a certain other space is a very big bliss. You should be able to search everything into a singular place as well. Moving along, there are a lot of campaigns that the hospital keeps running, which is, for example, You Have Us or For Your Life, like you could be naming it anything. There are separate campaigns that the hospital runs in order to reach out to more of the specific patients and the clients. All of that can be taken care of in a singular space as well. And the campaigns can be dealt with accordingly and separately. Now, we did talk about the text analytics, which was the specification about the tagging and the classification. Over here, what we're seeing is the handwritten form, and this is incorporated again into a singular space in a singular platform, where we see the results being extracted and given to us into a nice form. There's a co-pilot on the side where we could be talking to it directly, and it would tell us the information that we're trying to get out of it. Along with it, there's a multiple other options, like it could be patient intake, translated forms, or image forms, and all of that can be processed and brought into the model for the further cleansing it as well. Then we move on and we see the incident reports or the handwritten forms or the translated form that are scanned right here, again providing the basic analytics and the advanced analytics into a singular space where the overview and the drill down is in a consolidated format, giving us all the filters right over here so we could get to specific ones that we want to. And we have cognitive search enabled over here, so whenever we try to search for the certain keyword, you should be able to get to the part that you want to. Over
Fahad,
here, we see the yeah.
Sorry for interrupting it, but so we have 3 questions from Jacob Matthew. We
Please.
can take them now if you want. We can do it after we're done with the session.
Definitely, Jason. We very much appreciate your collaboration over here. Let's hear it.
Okay, so Jacob wants to know what services can you provide for institutions that want to transition from a paper-based medical record system to an electronic one?
That is an amazing one. So see, again, the basic part about that is, as I just showed you into the ones right over here, we'll have to perform. Usually what we do is anytime we do an on-prem to cloud migration, I'm just giving an example so you would understand it better how that goes. Anytime we're doing an on-prem to cloud migration, we say that we're going to be doing two things. The first thing is to do the historical load, like whatever data you have, we put all of that data into the cloud first, and then there is incremental data, which is like whatever data you're getting each day, every day. We try to build pipelines for that and bring it into the system. Same thing, same concept will be applied to your situation or condition over here. So if it's paper-based, first and foremost, we will have to do the conversion, the OCR. So we will take all of the papers and the data right in there and convert it into the electronic documentation and get the insights out of it. After we're done with all the paper information that you have, we're going to be converting your workload into the digital one. So we will do the trainings as well. So you would be able to know that what kind of web space or UIs we'll be creating for you, along with the one consolidation in the fabric, so that any data that is coming in new should directly go to the lake digitally. Does that answer the question?
And Jacob also has a couple of questions. So he wants to know for
Please.
text analytics, what are we using, ICD or SNOMED for text recognition?
Definitely. So, yeah, Mr. Safdar, you want to go ahead?
Yeah, let me take, I think I have three questions from Jacob in front of me. I think the first one you have already responded, Fahad. So the second one is for text analytics, are you using ICDs now for text recognition? Yes, we are leveraging the cognitive services and the OCR libraries of the Microsoft for digitization of the prescriptions and your international documents, right? ICD, which is I think International Classification of Disease, right? I think you are referring to that. So yes, we are leveraging this cognitive services, OCR libraries. And second one, I think you are asking, are you able to connect your APIs with other medical libraries? Yes, we have a platform agnostic integration platform that built on top of Microsoft solution. So we are leveraging that, and we can have a technology agnostic platform for third-party integrations as well. Yeah.
And if I may add to the last one, that the
Sure.
integrations are not just like limited to the other parties that are available within your domain or within
Exactly.
your reach. Like you could even be getting the data from the Ministry of Health, or you could be getting the data from the United Nations as well.
It's
There are
agnostic. Yeah.
exposed,
Yeah.
there are exposed APIs, so you could be comparing your data to universal standards, and trying to see like which path you want to go to. So anything that is available out there could be integrated in there.
Yeah.
Are we done with the questions?
Yeah, we're good.
Yeah.
Thank you. Share it.
Mr. Jacob, thank you for your question, and I hope that we have answered it. If not, you could definitely comment back and we'll get back to that. Now, the part that I was just about to, we have a couple of more screens to show, and I'll be wrapping up my part and handing it over to Mr. Safdar Hussain. The call center part is pretty important. We have seen that a lot of times we are ignoring the part where the operations team is taking care of all the incoming queries that are coming in. Now, previously, what we used to see was something that was not as advanced as what we see right now. This is how it used to be in the beginning, but now we have moved to a little bit finer places, which is looking like this. We have the scripts coming in. We could be taking in a look at what script is working when the agent is talking to the patient. Again, there is certain kind of analytics and model training done on top of that, telling us what kind of a script works better. It also recommends the scripts that you want to be talking about in a certain way to the patient, so you would know exactly how the things are going, right? There is summary as well, and total calls and the wait times coming in at separate times as well. A little bit of lag over there, but I hope we do get the idea that where we're trying to get, that it put everything into a consolidated format, trying to put the analytics on top of what we're talking about, getting the summaries in as well, telling you what the total calls are or the wait times specifically. Because see, it's not just the treatment that the patients are getting, it's also the support and the aftermath that happens after it. with that, I would like to end my operation analytics part and move to the continuous patient monitoring part, which Mr. Safdar Hussain should be taking care of.
Thank you so much.
All right.
So I'm assuming the screen is visible to you, guys?
Yeah.
All right, thank you. Hello, everyone. So today we will explore how Microsoft Cloud for Healthcare, empower health team collaboration and enable continuous patient monitoring. And Microsoft Cloud for Healthcare provides capabilities to manage health data at a scale and make it easier for healthcare organization to improve the patient experience, coordinate care, and drive operational efficiency while helping support end-to-end security compliance such as HIPAA and GDPR and interoperability of health data. So based on today's agenda, we'll cover empower health team collaboration and its most important area, which is continuous patient monitoring. All right, so let me explain how Microsoft Cloud for Healthcare is transforming health team coordination and patient care. Imagine seamless collaboration, simplified workflows, and accelerated decision making across your organization. So this is now reality due to the Microsoft Cloud for Healthcare. So by enhancing the team coordination, we can streamline operations and provide faster, more accurate support, and patient can easily connect with the health team to on their terms, right, simplifying routine tasks and significantly improving satisfaction and transparency in the care process. But that's not all, right? So, and Microsoft Cloud for Healthcare is also helping the clinicians stay connected across all health system and to their patient by offering new home healthcare plan management applications and remote patient monitoring features. And it's providing robust functionality in Dynamics 365 care management features that allow care managers to develop and follow through on the care plan activities and their goals, set timelines, and view the timeline, right, of the patient care plans. And they can improve workflow efficiency as well, right? So this is how it works, single pane of glass. Any question?
No, very good.
All right, okay. So Azure actually enabled the creation of telemedicine platform and remote patient monitoring systems, right? So these solutions support virtual consultation and remote diagnostics and continuous patient monitoring, improving accessibility and patient engagement. So let's dive into this section in more detail. All right, so in the healthcare IoT space, continuous patient monitoring is a key enabler for reducing the risk of reoccurrence, managing chronic disease more efficiently and effectively, and improving patient outcomes. You can split continuous patient monitoring into two categories: inpatient monitoring and remote patient monitoring. Inpatient monitoring, in which care team use medical wearables and other devices to monitor patient vital signs and medical condition within a hospital without having.
Just a quick one. Sorry, Mr.
Yeah.
Safdar, just a quick one. Are you able to see the screen? Because I just want to make sure that we are in sync with the screen and what you're talking about. Like what specific place you're on.
Remote patient monitoring, actually. Is it?
Yeah,
all right. Remote patient monitoring.
Yeah, now I can see remote patient monitoring. Before that, it was stuck on the.
Anytime you want to move, like just let me know next, and we will go next.
Oh, I'm sorry.
Do you guys want to take up the question? Jacob wants to know what are our integrations with medical monitoring devices and medical wearable devices.
Oh, that's an interesting question. By the way, in upcoming slide, you would have the answer of this question, right? Okay, so we were discussing about the inpatient monitoring and remote patient monitoring, right? So remote patient monitoring care team use medical wearable to monitor the patient at home, reducing readmission risk. Wearable data ensure patients follow the care plan and alert the care teams to issue before they become the critical. And these capability are uniquely helpful for treatment and care during COVID as well. In the past, we all faced that issues, right? In the COVID-19, we saw that since it allows clinicians to monitor patients through IoT-enabled devices and RT analytics, so it's really helpful, right, in this situation specifically. Yeah. Moving to the next slide. All right. Is it visible to you guys?
Yeah. Go ahead.
Yeah.
All right, thank you. So remote patient monitoring allow healthcare provider to monitor and collect medical and health data using apps and wireless devices through the Azure data Meditech device services. The healthcare organization are also enabled to gather data from various medical devices and convert them into FHIR resources that can be leveraged from the care management solutions and that reduce readmissions and increase customer satisfaction by monitoring the recovery and rehabilitation data as well. Okay. So in the next slide, you can see the one scenario. You could maintain high quality care with the minimum staff by monitoring remotely and using telesitter program to keep high risk patients safer, right? Let me share one more scenario with you guys where the home health nurse as a supervisor, she helped patients to manage their health through continuous patient monitoring, okay, of their recovery and rehabilitation. So Smart Assist alert the home health nurse supervisor that the patient who is recovering from the recent knee surgery at home and he has lost a significant weight as reported from his IoT wearable devices using the IoT connectors to the Azure API for FHIR. And the home health nurse supervisor schedule a home health visit using the scheduling dashboard, which I'll show you and demonstrate you in upcoming slide. The patient receive a notification on his cell phone about the virtual home visit the next day with the care provider, right? And they're preparing for the visits and the care provider accessing all the patient's information. And after appointment, the care provider update the patient's care plan on the portal and the patient's clinical health information is maintained in the Azure API for FHIR and ensuring that his entire care team is kept up to date on his recovery. So this is how healthcare organizations are extending patient care beyond the hospital walls, reducing readmissions and supporting patient from home, right? So guys, this is a diagram depict the end-to-end reference architecture for Microsoft Cloud for healthcare. As your organization modernize process, it would also look at, overhauling the healthcare provided to your patient. For example, providing service such as continuous patient monitoring, health data, access to the patients, and bringing medical imaging data to the cloud. You can see here, Azure Health Data Services delivers a FHIR-based PHI stores that meets health compliance and governance rule, right? And text analytics for healthcare that we have explained in a detail in the last few slides that extract and labels relevant medical information from unstructured text such as doctor notes and discharge summary and prescription and other documents of the patient. So overall healthcare organizations have been increasingly adopting a Microsoft Azure due to its versatile capabilities, enabling them to enhance patient care and streamline operations and optimize the data management as well. So guys, in our next webinar, we will discuss and share some smart personalized care and predictive care solution. You need to stay tuned, right? So before jump on the another slide, I would love to share.
Yeah, I have a quick question on the previous one regarding the care management and how is Microsoft Dynamics 365 helping in care management? Like what kind of functionalities do we see?
So all right,
because it just triggered me like there was this question was like by a customer. I just want to ask.
I've already explained, but again, let me show you some demo on this, right? this is the activities and the cases listed down here, leveraging the Dynamics 365, a single pane of glass where, the health team can manage home health and remote patient monitoring, and they schedule their, the visits, and they can monitor their gadgets and IoT devices health as well, right? You can see there's an arm break Velcro where broken eyeglasses. This is the different cases listed over here. So they need to replace or visit at their home, and they have a schedule similar. For example, there is a health analytics. You can see these activities, overdue activities, and there are upcoming activities over here. And they can leverage the Copilot for any, the immediate action or query to get an insight from or the patient related, right? So this is how this 360-degree view and, the care management system, we can leverage the Dynamics 365 care management solution, as well as we have the patient service center, patient access, home health, and other care management solution as well, right? So this is amazing. We have a one view for each and every operation, including, team care collaborations and remote patient monitoring. Yeah. So
Okay,
for the,
yeah,
go ahead.
I cannot see the screen. I don't know what happened, but I know we're almost at the end of it. If you have, you were saying something. I'm sorry.
No, I think we are good. If you have any question, feel free to,
No, I think we're done. We're almost reaching to the. We just only have 12 minutes left. So before we take questions from the audience, I just wanted to mention how we as a team, along with QDS, can help everyone that is there. We have our specialist team that can work with you by engaging in different kind of sessions. Like we can have some workshops where we'll sit with you, we'll identify, and we'll go through the challenges that you're facing on a day basis. And we would take up, it's like as if it's our own business, and we'll work with you, and we'll help you come out with this with the problem that you're facing currently. So if anyone has any issues, for instance, if anyone is facing issues with our AI, for optimizing the business, we jump in, we would navigate with you through the business, using our technology expertise, and we'll help you out in the process. I will reach you out right after this webinar with an email. We can get on a call. We can schedule something. I'll bring in my specialist team, and we can take it from there.
Yeah.
So I see the audience. If anyone has any questions, kindly please post it in the chat section, and we'd be more than happy to answer.
all right. If not, then see you for the upcoming webinar, guys. Stay tuned. Yeah.
Sure. Awesome. I think we don't have any questions. I think we have explained everything. In case if anyone does, then you can reach out on the email address that you see on the screens, and we can take it from there. Wait for the next webinar. I'm sure we're going to be having another amazing session. Thank you so much, gentlemen, for joining in. Thank you, Moussa. Thank you, Fahad. Thank you, Safdar.
Thank you.
Thank you very much, Tim.
Thank you. Have a good day.
Thank you.
Thank you. Bye.